Today, we're thrilled to welcome Chad Pendleton, Principal and CEO of Pendleton Advisory Group. With a PhD in public policy and administration and over 20 years of leadership experience in health plans like AmeriGroup, CareSource, and United Healthcare, Chad has been instrumental in driving growth and improving healthcare access. We're excited to explore his insights on the future of healthcare. Welcome, Chad. Thanks for joining us.
Thank you for having me today.
Thank you. So, same here. You have so much experience for us to learn from. I would love if you would be able to share a little bit about what I know is a very broad question, but about what it's like to lead health plans, and we could dive into specifics.
Yeah, absolutely. And again, thanks for having me here today. I've spent the past 30 years immersed in the healthcare industry with a primary focus on leadership roles within the managed care arena, as you alluded to. Over the course of my career, I've had the opportunity to lead healthcare organizations across a range of sectors, particularly within the government healthcare programs sector, where I've developed really a deep expertise in managing Medicaid, Medicare Advantage, and other public health initiatives. And throughout that journey, I've overseen large-scale operations, strategic planning, network development, and fiscal management across multiple states. I believe I've touched probably 23 different Medicaid states as it stands today. But guiding organizations to deliver results in both competitive and challenging environments. I've consistently worked over my career to improve healthcare access and drive quality improvements in the health plans that I've led. And so I'm excited today, to share my insights and experiences and to explore how we can continue to evolve and improve healthcare landscape for all.
Yeah, then there's so much to do. So what drew you into this space of leadership in healthcare to begin with? And perhaps some of the experiences just led to wanting to keep doing that?
Yeah, great question. I originally entered healthcare leadership because I saw the opportunity to make a meaningful impact on people's lives. Early in my career, I witnessed how inequities in healthcare access could severely impact outcomes, and I wanted to be part of that solution. I saw that firsthand within my own family, and so over time, my perspective has evolved, especially in understanding the intersection between policy, technology, and care delivery. And so, as I'm sure we can all agree, the pandemic has reinforced that need for adaptability and innovation in this space. And so, really, getting those experiences is what led to my, love and passion for this space and desire to continue working within it.
Great. And what do you feel in your role are the biggest changes that you and leadership and healthcare plans, and I guess even government and how that relates, can make right now?
Yeah. So, again, as we think, about, the post-pandemic world, health plans are facing several critical challenges with workforce shortages, Medicaid redeterminations, health inequities, rising costs, and shifting member expectations being the most significant. And so first, starting with workforce shortages, this is a growing concern across a number of healthcare sectors. The pandemic has led to burnout and attrition across healthcare, from frontline providers to administrative staff, that's directly impacting service delivery. Health plans are now struggling to maintain adequate staffing levels to support case management, member services, and provider network management. And so this not only puts pressure on operations, but it also affects the ability to meet quality and compliance standards. Health plans must rethink workforce strategies. That includes incorporating solutions like automation, more flexible working environments to manage these shortages effectively. So, secondly, Medicaid redeterminations, as I mentioned, that has greatly impacted the financial stability of health plans. During the pandemic, continuous enrollment policies were in place, and that led to a spike in Medicaid membership across most health plans across the country. However, with the post-pandemic, resumption of Medicaid redeterminations, we've seen millions of individuals that have lost coverage. And that's either due to ineligibility now, or that's due to administrative errors. And so while, again, a lot of this was expected, that sudden decrease in membership has created a financial strain for health plans, which must now adapt to those fluctuations in enrollment while still meeting their financial obligations and maintaining adequate provider networks. It's no secret that there have been a number of health plans, some of the large health plans around the country, Medicaid space, that have had a significant downsizing as a result of some of these membership losses. But in addition to these, the health inequities remain a pressing challenge. The pandemic exposed significant disparities in access and outcomes, and health plans are under increasing pressure to develop strategies that address social determinants of health and improve care for vulnerable populations. This requires greater investment in community partnerships, data analytics, and tailored interventions. Rising healthcare costs, it continues to be a challenge. This seems to be an ongoing narrative within this sector. Post-pandemic inflation has increased demand for services and have raised the cost of care. That's put pressure on both the health plans and their members. And so to address this, many health plans are transitioning to more value-based contract models. But this shift requires a significant investment in infrastructure and collaboration with providers, which sometimes can be difficult to scale. The rising healthcare costs is also a continued challenge. The post-pandemic inflation and increased demand for services have raised costs of care, and that's been an ongoing narrative. But that's put pressure on health plans and their members. So to address this, many health plans are transitioning to value-based care models. But that shift requires significant investment in infrastructure and collaboration with providers, which can sometimes be difficult to scale. But finally, the pandemic also transformed member expectations. People now expect more convenience, transparency, and also personalized care experiences. And so health plans have to really invest in digital health solutions. Some do that better than others. But those are digital health solutions are things like telehealth, remote monitoring, enhanced member engagement tools in order to meet those demands. So again, health plans are navigating a very complex landscape that it really requires them to be very thoughtful in their approach in managing the workforce shortages, the financial strain from the redeterminations, the rising costs, and then these member evolving expectations that I mentioned, all while striving to address health inequities. And so each of these challenges requires strategic investments in both people and technology to ensure sustainable growth and improved outcomes.
That's a lot of things to be working on, grappling with internally, just to be able to have the impact externally, especially with health inequities and people who don't have access to healthcare. What
Absolutely.
are some of these innovations that you think or foresee in the future being available and partnering to help with these items?
Yeah, so several key opportunities for growth I see, particularly in the telemedicine, preventive care, and value-based care models. Telemedicine, as we learned from the pandemic, has proven its ability to expand access to care, especially in the underserved populations. Health
Mhm.
plans should continue to capitalize on that trend by integrating virtual care as a permanent component of their service delivery. In addition, the value-based care models offer a tremendous opportunity to not just reduce costs, but also to improve outcomes by aligning incentives with quality and outcomes rather than volumes of services provided. And so this is something that I expect to continue to evolve within this space. It's very important that as health plans look to roll out, especially more of the value-based care models, that they are working in tangent with the provider community so that these are measures being pulled into these models that truly work for both sides, the plan and the provider.
Yeah, I'd love to talk about the value-based care model a little bit more. Our listeners are
Mhm.
probably very varied. So, do you mind breaking it down as to how you see, like, what it is, what it really looks like tangibly, and how you see this working for all sides?
Right. So, it's important. Health plans have to show that there's quality in the services being provided, right? Also recognizing that the cost of services has increased or the demand for increased reimbursement is there. And so in order to do that, the health plans have to put together program models, incentive models that make sense for not only the provider, but also that the health plan can administer. And so sometimes that's the challenge. You have a desire for there to be unique metrics that are being monitored against, measured against, and incentivized. But if they are metrics that are not as reliable or relevant, that providers are able to truly have a hand in resolving, that can have a significant impact on the ability to achieve success across those metrics. And so, what good is there having a value-based incentive model that has, I would say, targets or milestones that can't be achieved? And so that's why it's important to have those conversations across, both the health plan and provider space to come into agreement with regards to what model would truly best work within their environment.
And where do these initiatives really stem from? Like, I see a lot coming from the federal level and then trickling down. But I don't know actually personally, like who's at the table for those meetings and decisions. And then even within the payer space, who's at the table for those decision making conversations?
Right, and so it varies, but great question. It varies. Generally speaking, within the health plan world, it's usually teams from both quality, the clinical team, the medical CEOs, medical CMOs, I'm sorry, as well as the network development team. Generally, are the ones that are pulling this together for the health plans. The health plans then are engaging with the providers. Generally, their office administrative staff and sometimes their clinical leads are managed on behalf of the provider. It's important that, again, the models that are designed are done so in a way that can be easily explained. That's where a lot of confusion and abrasion comes when very complex models are put on the table that sometimes are difficult to follow, and there is no
Mhm.
understanding gained from the provider community as to how they can go about achieving these targets that have been met. And so when I say at the table, the people that are at the table again are those from the health plan within the specific roles. Again, the chief medical officer is sometimes involved, as well as the development team and the quality team. And then on the provider side, as generally speaking, it's the administrative team, executive team for the provider staff that's involved. When it comes to the specific measures that are chosen, sometimes it's dictated by that state Medicaid agency, or
Mhm.
sometimes it's generally following CMS HEDIS HEDIS guidelines or STAR measures as it pertains to Medicare Advantage. And so, again, any number of metrics could be involved or at play within a given value-based contract design. And so, it's important to one, ensure that you've got your right population identified. One, that you are identifying metrics that can be adequately monitored and tracked, and that also you have alignment with the provider so that the provider clearly understands their contract, how to achieve these incentives, and that they do, in fact, have an opportunity to impact the results there.
So what's it like being a leader, like to be CEO of these plans and trying to choose where you put your resources and direct, like how do you do that? What's that like?
Oh gosh, good question. Where do I start? So, really, effective leadership in today's healthcare environment it's all about being agile, resilient, and committed, really, to a vision that prioritizes both outcomes and equity. In my experience, especially leading during crisis, whether it was a pandemic or whether it was a major operational shift, that has taught me the importance of clear communication and adaptability. And so, for example, during the early stages of implementing the new care model, I first saw firsthand how essential it was to empower teams to make decisions quickly, while staying aligned with our long-term goals. And so, again, within the health plan arena, it's constant churn with regards to competing priorities. And so, being able to focus, align your teams with regards to what some of the direction is and what our targets are, and having them buy in is critically important to being successful as a leader within the health plan space.
And do you have any specific challenges with doctors or providers that like are we would want to know about? This is like a very interesting perspective in for doctors that they usually don't get from your side of things. Like what would you want us to know?
So Good question. And obviously, providers' experience, will vary across health plans. But I can tell you that in the health plan space, health plan leaders and health plan, those team members can be some of the most compassionate people within the business, especially, in my experience in the government program space. These are individuals that come to work every day with the desire to make someone's life better and more healthy. They are truly looking to identify what our members need and to ensure they receive those services. And so I believe that the biggest opportunity is really in there being collaboration. That's where I've seen most success. That's where I've been successful within my time within the healthcare arena, the health insurance arena, is being open, being available, and open to having those conversations with providers, helping them understand and being transparent with regards to what it is we're attempting to do, and then gaining their alignment to work with us in achieving those goals. I think, by and large, providers also have the right heart when it comes to servicing their patients. They want to ensure their patients are receiving the services that they need, that they've requested. They want to ensure that the health plan is listening and understands. Also, I think that it's important for health plans to understand, some of the administrative challenges that providers have. And so, again, I think that there's an opportunity for there to be greater communication. I do believe, in some respects, being virtual and also, leveraging, email sometimes too much becomes a crutch. And so I believe picking up the phone for there to be more engagement, sometimes in
Hmm.
person, I think that would truly help improve some of the relationships that have taken a hit over the years.
Yeah, that makes a lot of sense. So if, like, say a doctor's listening and they need support and they don't feel like they're getting it, like they should reach out and ask and directly engage. Is that what you would tell them? And who would they go to?
Absolutely. In most cases, a provider will have an assigned provider relations representative. Depends on how the health plan is structured. There are various models that are in place in health plans with regards to staffing and how they manage provider relations. But generally, there is a field provider relations representative. There's also the in-office provider relations representative that can assist the provider and help answer questions they have, but also usually there's an opportunity for them to schedule time for a provider rep to come out to their office and sit down and have a
Mm.
conversation. That should be the starting point, really. And if they don't know who their provider relations rep is, if they call the plan, I'm sure they can get that answer relatively quickly.
Okay, great. And can we dig into a little bit about equity in pediatrics with kids and what you're seeing there, where the holes are and where we can help fill it, where the focus should be?
Yeah, so I would say, specifically, Medicaid plays a crucial role in advancing health equity, particularly for pediatric members. One key strategy the health plans can employ is focusing on early intervention and preventive care. Really what we talked about a little earlier with EPSDT. And
Hmm.
so by addressing healthcare issues before they become severe, and by improving access to the pediatric specialists and developmental services, I believe we can significantly improve long-term outcomes for children. Additionally,
Yeah.
addressing social determinants of health, such as food insecurity and housing stability, that will be critical to improving health equity in these populations. Again, I think as I think most are coming to understand, social determinants of health is becoming a major factor in being able to resolve many of the issues, the conditions that are impacting, a multitude of populations across age groups. But definitely, excuse me, definitely within the Medicaid space, how we engage and impact on some of those social and environmental factors is crucial to improving the health equity in these populations.
So whose shoulders does that responsibility fall on? Because I think that's shifting a little, maybe.
You know what? I think it's everybody's responsibility. I really do. I think it's the health plan's responsibility. It's the provider's responsibility. It's the community's responsibility and the community-based organization's responsibility. It's the state Medicaid agencies, insurers in general, and the federal government to ensure that the right focus and attention is applied to this area. Again, I come from the belief that SDOH is everyone's job. Ensuring healthcare access and equity for those that are most vulnerable is critical.
Gotcha. There's data showing that there's such a lack of access to pediatricians in rural local communities, especially subspecialists. As you mentioned, it's just so hard to get access to them, or they're not traveling like 3 hours somewhere. Kids end up in like emergency rooms really focused on adults, or urgent cares where they're not specialized in pediatrics, which really uh, challenges the health outcomes that they will have, really detrimentally sometimes. Is there how can we work on that side of things? And maybe this is part of what you touched on with the telehealth opportunities, or are there concrete ideas being floated and used in terms of innovating in that space?
Yeah, so if I understand your question, I think this is an area where someone like Blueberry Pediatrics is a great example, of how innovation in pediatric care can truly make a difference. If it's the focus on providing virtual, 24/7 access to pediatricians, that allows the health plan to meet the needs of their Medicaid families in a way that's convenient and accessible. And that's what excites me most about the potential there, and looking to reduce unnecessary ER visits, improving chronic condition management in children, and supporting preventive care efforts by making pediatric care more accessible. Uh, this is the kind of innovation that can really drive better outcomes for pediatric members and help close gaps in care.
I mean, I couldn't agree more. I think if we have more ideas like this in partnership with the MCOs, with payers, this could be huge. It doesn't, have to be Blueberry. Just I think that the innovation and technology end of things can really help in this space. Would you think that this would help to increase? You said there's an issue like with improve with member health. Does this help that at all?
No, it does. Again, I think what this does is help to provide access. We have to be able to provide services to members where they are. And again, sometimes because of some of those social determinants of health factors that we just talked about, that makes it challenging for someone to receive the care they need when they need it. And so that's where the technology comes into place and remote monitoring comes into place. Being able to provide services to someone that is not able to get to the doctor's office, their family is not able to take off work in order to help to get them to a preventative care visit. And so what happens? They end up using the emergency room, for non urgent care. That's what we want to avoid. And so again, having access to the right technology, that being made available through that member's health plan is critically important to being able to address some of these equity and access issues that exist.
Are there other parts of the space and innovation that you've seen in the last few years that are very exciting?
Yeah, so one thing, as I think about opportunities, um, when I was with one health plan, and this was during the onset of the pandemic, I was extremely excited with the rollout of a eye retinal mobile eye retinal exam program. This was done because there were so many of our members that were needing to have their diabetic eye screened, and obviously because of the pandemic and social distancing, many of these individuals, could not leave their residence. They could not go to the doctor's office to receive these screens. And so, the initiative that we had in place was we purchased, I believe it was about 10 eye retinal machines for primary care offices, so that they could then provide these services remotely. And so, again, the remote availability of technology is critically important, in my view, to be able to address some of these challenges that we have within this space.
Yeah, that's very cool. So, how do you see the role of technology and data evolving in the space in order to reduce costs and improve member outcomes?
One example that stands out, is a collaboration that we had with the telehealth provider that was used to improve access to Medicaid members in rural areas. And so by integrating virtual care into the health plan's offering, we were able to reduce ER visits for non-emergency issues and improve preventive care visits, all while making it more convenient for families. This partnership led to improved member satisfaction and also better health outcomes. And then also, again, so leading back to what I was speaking to with regards to the retinal eye camera program, that was developed in response to data from the first year of the pandemic. What we found was that only one of every three members with diabetes had received their diabetic retinal eye exam, and that was performed in 2020. And so Black members specifically had a much lower rate for receiving these exams, and so that led to my health plan engaging with community stakeholders and determining that providing the ability for more primary care offices to have the technology to provide these screens, to a member in the comfort of their residence, their home. This was allowing us to help achieve that gap closure and ensure those members were receiving the screens that they needed.
Yeah, so it's really about meeting them where they are and where they're
Exactly.
comfortable. And so that to me sounds like that would incur a lot of cost. Can you tell me how that eventually and how your plans would measure the return on investment for those sorts of things, and if they were if they were very robust?
Yeah, absolutely. So obviously, ROI is always, can sometimes be challenging to show. But when you think about, a member that's needing to have these screens done, and especially if they are, someone with diabetes, and as those conditions worsen, those become much more costly. And so the ability to provide these screens to someone and be able to identify issues that may be developing before it happens is, in my view, priceless. You end up spending much more by not addressing something early on in its early stages when you can in most cases. And so, again, I think that's an example of why preventive services and screens are so critically important because, again, by providing these screens early, we're able to find, detect, resolve issues before they go to a state where they either can't be resolved or at best, costly for us to fix.
I couldn't agree with you more. Do you think others think this way? Like we're not the only ones, right? Are there health plans focused on this?
There are, we're not the only ones that think this way. Again, you have very smart leaders and people that are passionate about, doing the right thing and ensuring that members are receiving the services they need, and trying to come up with innovative ways to do it. So we're not the only ones that are talking about this, and I can assure you that as many of these innovations are shared publicly, health plans take note, and individuals are always looking for ways to improve what they do and to provide better reach and ensure access to services for their populations. And so, absolutely, this is a discussion that's occurring, and the more people that hear conversations like this, will act and ensure that members are receiving this type of access.
Okay, great. That's reassuring to hear. I love that. All right. What else have I not touched on that you would want to talk about in the space of either value-based care, pediatrics, cost savings, membership health, challenges of health plans, leadership? What else can we enlighten our listeners about with all your knowledge and experience?
So the future outlook, I believe, looking forward, I foresee really major shifts toward value-based care and personalized healthcare through data and through AI, and a continued focus on addressing social determinants of health. Health plans will need to evolve from simply managing care to actually becoming more proactive in engaging members, helping them make better health choices, and creating systems of care that prioritize long-term outcomes over short-term fixes. AI, as I mentioned, is, in my view, going, and I'm sure with others as well, is going to have significant impact on this industry as more individuals become comfortable with it, as more regs are put in place so that it protects the end user, so that it's used in the proper way. But I do foresee there being incredible efficiencies that can come from us deploying more AI system learning within the technology and solutions that we are providing within this space today.
Do you mind giving like one or two examples of how AI can do that?
Yeah, one immediate example that I can think about is there are a number of requirements around health risk assessments that are needed to be done on a health plan's membership. And that can be a very tedious process. Not only, the fact that you've got thousands upon thousands of members that need to have these performed on, but reaching those members and having the resources deployed in order to do that. That is something that I've seen being done very effectively using AI, where AI, through programming, is making the outreach to the member, asking questions with regards, that are outlined in the health risk assessment, receiving those answers in a very natural two-way communication between member and AI, and resolving, capturing that data and putting that in digestible format for a health plan to consume. That is one way that I see having a significant impact on the ability to reach more individuals and gather information in a very efficient way, summarizing that data and being able to leverage that data, to make informed decisions about care management.
That's so interesting. All right. Well, thank you so much for joining us today. I've learned so much. I hope our listeners have. I have one more question before you go. What advice would you offer to emerging leaders in the healthcare space, particularly those looking to make a big impact in health plan management?
No, again, look, thanks so much again for having me on here. And this is a great question to wrap things up. My advice to emerging healthcare leaders is simple: focus on innovation and empathy. Understand the systemic challenges, but always stay grounded in the human aspect of healthcare. Leaders who are adaptable, willing to embrace new technology, and maintaining the focus on equity and inclusiveness will definitely make the biggest impact. And remember, leadership in healthcare isn't just about managing, it's about inspiring others to drive change. And so if we do those things, I believe that we are going to be in good hands with emerging healthcare leaders down the road.
Well, thank you so much for being with us. I've learned a lot. I hope our listeners have. I really appreciated your time and learning about your background and all the progress that has been made under your guidance and leadership.
No, thanks so much. I appreciate you having me on.
Thank you all for tuning in to today's episode. Be sure to subscribe to the show for more episodes. And if you love the show, if you haven't already, please be sure to leave us a 5-star review.